The three-dimensional geometry of the pelvis is difficult to understand. For this reason, I've created pelvic musculature for dummies. Let's start by first adding in the two muscles that create the lateral walls of the pelvic cavity. Those muscles being piriformis and obturator internus. Now, piriformis is a muscle that originates on the sacrum and exits the pelvic cavity via the greater sciatic foramen. The greater sciatic foramen is located right here. Once it exits the foramen, the muscle is then going to wrap around the hip to attach onto the greater trochanter of the femur. Now, the femur, of course, is not present in this model, but I think that you can imagine where that would be located. Now, because the muscle attaches onto the femur, this is actually a muscle of the lower limb, and specifically, it's a lateral rotator of the hip. Let's add the muscle in so that you can visualize it. This is piriformis in its proper location. Now, the piriformis is also commonly referred to as the bed of the sacral plexus, and this is because of the fact that the sacral nerves that exit the sacral foramina, located right here, are going to lie on top of the muscle just before they exit their respective foramina, that being either the greater sciatic foramen or the lesser sciatic foramen. Our next lateral wall muscle is that of obturator internus. Now, as its name implies, this is a sheet of muscle that attaches to the internal portion of the obturator membrane that covers the obturator foramen. So here is our obturator foramen, and you can clearly see the membrane that is closing up that hole. Now, this is the external surface of the membrane. This is the internal surface of the membrane. So this is the location in which obturator internus is going to be attaching. Let's add the muscle for effect. This is obturator internus in its proper location. Now, take note of this. There's a tendinous extension that exits the pelvic cavity via the lesser sciatic foramen. And the lesser sciatic foramen is a space that's located between the sacrospinous ligament and the sacrotuberous ligament. Perhaps, however, that you can see this a little bit better from a posterior view of the pelvis. Once again, we see the sacrotuberous ligament as evidenced by the fact that it spans from the sacrum down to the ischial tuberosity. And we also see a sacrospinous ligament here as evidenced by the fact that it's spanning from the sacrum to the ischial spine. Note the little hole or space between those. This is the lesser sciatic foramen. This extension of blue clay represents the tendon of obturator internus, which is also going to attach onto the greater trochanter of the femur. And again, then, obturator internus is also a lateral rotator of the hip. Now let's move on to the muscles that create the bowl of the pelvis, otherwise referred to as the pelvic diaphragm. Now keep in mind that these muscles are going to be what provides the major support of the pelvic viscera. The first of these muscles, and rather less significant of these muscles, is coccygeus. The coccygeus lies on the internal surface of the sacrospinous ligament. So let's add in these two muscles. Here's coccygeus in place. So now we're going to move on to levator ani, which creates the vast majority of the bowl of the pelvic diaphragm. Now, levator ani is actually composed of three individual muscles, but we will just refer them collectively as levator ani, because never would you be able to differentiate between the three muscles within the lab. So levator ani is a broad, thin muscle that actually hangs off of obturator internus. So rather than attaching to bone, at least in this specific location, it's going to hang off of the fascia that covers obturator internus muscle. So we have, again, in blue, we have the obturator internus muscle, and the levator ani is going to attach and hang off of the fascia that covers this muscle. Let's see how that looks. So here we have levator ani in place, and where the green meets the blue is the location in which the levator ani is hanging off of the obturator internus muscle. And we give this location a specific name, that of the tendinous arc. Now, according to my clay model, it looks as though levator ani closes off the pelvic cavity. This is not completely true, however, as we have some structures that must pass through it, namely the urethra, vagina, and anal canal in females, and just the urethra and anal canal in males. And lastly, let's throw in the perineal membrane. While not exactly a muscle per se, I think it's important to understand how it fits in with the rest of the pelvic geometry. The perineal membrane is a triangular sheet that extends from ischiopubic ramus to ischiopubic ramus. Now, why do I say it runs horizontally? Well, that's because it does if you're holding the pelvis in its correct anatomical position. So many students, I've noticed, will hold the pelvis like this. This is not how it is actually oriented in the body. Rather, it is tilted forward so that the anterior superior iliac spine and the pubic tubercle are in the same vertical plane as such. When the pelvis is in this position, you can then see how the perineal membrane is running horizontally. I almost like to think of it as a plate that holds up the bowl of the pelvic diaphragm. Now, granted, this is kind of a stretch of an analogy because the bowl of the pelvic diaphragm is laying on its side, but hey, all of our analogies can't be great, can they? Keep in mind that like levator ani, some structures need to pierce through the perineal membrane to exit the pelvic cavity, namely the urethra and vagina in women and just the urethra in males. Note that the perineal membrane does not extend past the urogenital triangle, which would end at the two ischial tuberosities. So it's the triangle located right here. So the perineal membrane does not extend past the urogenital triangle into the anal triangle, which would be located from here to here. That being the case, the anal canal does not need to pierce through the perineal membrane. That completes my video on the three-dimensional geometry of the pelvis. I hope you found it useful. Now go find these structures in lab.